Hello friends, I am Dr. Sachin Kuber from Pune city, Maharashtra, and today I am going to discuss about the real world differences between the first generation of ZSR circumcision stapler and second generation of ZSR circumcision stapler. So recently in India, ZSR second generation green circumcision was launched, and if you are following our channel, you must have seen 3 or 4 very important videos discussing and showing the exact operation with the help of second generation circumcision. Now the development has happened because there were so many problems in the society that required exact perfect result treatment in case of the penis surgery. Now what happens, many times there are complications in the penis like diabetes, fungal infection, yeast infection, phimosis, or some people have extra long the foreskin and they want low cut circumcision. Sometimes the inner foreskin that is adherent to the glans penis. Now these are the complicated situations, and in those situations the surgery will require perfect precision cut circumcision, and in that scenario the normal first generation ZSR was lacking behind in giving perfect results. That's why the company has come up with a special insight window and a notch on the second generation ZSR green device that is helping the surgeons to offer a perfect circumcision solution, near perfect circumcision solution, because there are the insight windows on the stapler device as well as the protection cup device, as well as there is a small notch. So all these 3 factors contribute to offer a better circumcision experience to the patients, because there is a very important need for giving perfect results, because many of the young patients come to me and they don't want any complications and they want to live a happy married life or active sexual life, and for that perfect results are very important. And for those perfect results, the new second generation ZSR device is very helpful, because as a surgeon I can tell whenever I can do a surgery or I am doing a surgery, if I get a perfect view of the penis and the foreskin, then I will be able to offer a perfect cut, because sometimes as discussed in low cut circumcision, when the person wants only 30% of the front skin to be removed, in that case in earlier generations it was not possible. I will give you example. See, this is the first generation ZSR original device and this is the second generation ZSR device. So as you can see, there are lot of differences in the first and second generation ZSR devices. Earlier, when I used to do low cut circumcision, I used to do it with just my experience since 2015. So last 7 years, now it is 2022, and last 7 years I am doing ZSR first generation circumcision. Because of repeated surgeries and a lot of surgeries, I got experience and how to do exact circumcision I came to know. But everybody is not expert in this process. That's why the company has come up with the new second generation, where there is a special window and there is a small notch over here to protect the frenulum. So if you can see, there is a window on the glans protection cup as well, and there is a window on the stapler also, and there is a special notch. You can see here, this is the notch. You can see and appreciate. I think you can see. So this is the notch which will protect the glans penis and avoid accidental injury to the frenulum, as well as whenever I attempt a low cut circumcision, I exactly see how much skin I can cut. So when I want the only 30% skin to be cut, I can do it with this window, and the patient is also happy because he has come to me for low cut circumcision and he wants a low cut circumcision, but in this device I can offer him perfect solution so that he is happy, and because he is happy I am also happy. So this is very useful for that condition. Sometimes there are diabetes complications, sometimes the glans penis is adherent, sometimes there is severe infection, balanitis, balanoposthitis, fungal infection, yeast infection, many problems are there, or viral balanoposthitis or herpes infections. So in those infections, what is important is the surgeon, as a surgeon, I should be able to see whatever is going on inside. So exact cutting of the skin with the protection of the frenulum area is very important, because below the frenulum there is a blood vein and it can rupture, it can produce a lot of pain, a lot of bleeding, and this is a complication. Recently I had seen many patients who have done a duplicate stapler operation at many places around my city. So I had to repair them. They come afterwards, but they did not come before, and after complications they visited me and I had to repair it and I have to do it all right. So because all this knowledge is there, I will be able to offer perfect solution to the problem. So now these are the differences, that there is a special safety catch. So when I fire this device, there is no accidental misfire, there is no unintended cutting or unintended damage. Also because of the notch, it protects the frenulum, as well as because of the window, I will be able to offer exact cutting of the intended amount of skin, because the upper part of the skin and the lower part of the skin are different. Upper part is a free part, down part or the below part is attached or many times fused with frenulum. So in that case, whenever perfect solution has to be offered, this is very helpful. So what is our choice? Our choice is first generation ZSR device, or the blue ZSR device, which has to be used for normal cases, normal circumcision, that is normal circumcision for phimosis where complications are not there, and this special device, that is a second generation device, can be used for more complicated cases, the BXO phimosis, fungal infection, balanitis, balanoposthitis, so many complications are there. For those complicated cases, it can be used. As it protects frenulum, there is a option that some patients don't want to lose their frenulum, and for that frenulum saving circumcision surgery is also emerging. So many patients who don't want to lose their frenulum, they can also benefit very high from this device, as well as the normal circumcision. Patients who are more enthusiastic and they want best of everything, so those patients also can consider this second generation ZSR device. That of course it is a circumcision stapler, that's why it can be used for normal phimosis or uncomplicated phimosis patients, and it can give excellent results. It can protect the frenulum, it can protect the injury, and this green part you can see here, that green part gives protection against misfire, because many times we have seen something moves on and the skin moves, and uneven cut is also possible with ZSR. Many times I have seen some other patients from other places where the surgeon sometimes does not apply it perfectly well, and because of that the patients get misfired unequal cutting of the foreskin. So on the right side it is more, on the left side it is more. The exact cutting and the equal cutting has to be done in order to avoid any future complications in the married life or sexual life. So this is very important. It gives a perfect balance between the surgery and the outcome results. I have already shared the results with this YouTube channel, so you can surely see those results. So today I thought that our stable has now two players, that is ZSR first generation and ZSR second generation. Of course anything can be used for anybody, but with the help of special insight and these 3 points where there is a window on the upper part, window on the lower part, and the notch for frenulum, this offers a really good excellent result to the patients who are looking for specific needs like low cut circumcision. Some enthusiastic people who do voluntary male circumcision, they can also highly benefit from this, because this is the most advanced and most well thought stapler. I'm not saying that because it is from ZSR only it is better. As you can see, there are 4 most important things which are changed from the earlier generation of the ZSR stapler. So first is, this is a safety catch which prevents the misfire. So there is no risk of accidental injury. There is a special catch in order in very bright red color, that it does not give any unnecessary firing of the device. Then number 3 is the special window over here, which will prevent any wrong surgery. It will be very useful. Next is, if you see this cup, this is a metal cup, very sturdy cup, and see, if you can see here the sound, this is completely metal, and this metal is well thought after. There is a special window over here to see the exact position, whether it is trapped or not trapped, the frenulum we can see. So if I can see, then I can be sure, and I am 100% peace of mind that I have done circumcision and I have not damaged any part of the frenulum. As well as there is a special notch and with a thickness, so that this thick part on this side and very narrow part on that side, if you can appreciate, let me show you. See, this is a thick part with a notch, and this is a narrow part. So what happens, when thick part is there, it pushes out the frenulum out of the way. So when this stapler will cut, there will be no accidental cutting or injury of the frenulum. So this is the most advanced, well thought after, these 4 to 5 points which make this ZSR second generation different or more superior to the first generation ZSR device. This is very helpful to the patients, as well as a surgeon. I am very happy because I can offer the exact demand and supply. Whatever the patient is demanding, the complications are demanding, they need an expert device, because problems and complications require expert surgeon and expert device. So this is the most expert and most advanced device which I have ever seen in last 20 years of my practice, and I must tell you that this is really a wonderful device to do surgery. So these were 2 main differences between these 2 devices, and I hope you like the video. If you have liked the video, please like and share and subscribe to the channel, and a sub to the channel would be very much green for me. So I hope you have liked my video. Please like it. Thank you for watching. Have a great day.